Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about Cushing syndrome. In particular, I will cover what is Cushing syndrome, how do you treat Cushing's, and how you can live better with Cushing syndrome. So to start with, what is Cushing syndrome? So Cushing syndrome is a condition that occurs when your body is exposed to high levels of a hormone, cortisol, for a long time. The most common cause of Cushing's, sometimes called hypercortisolism, and is the use of oral corticosteroids medication, or from the use. The condition can also occur when your body makes too much cortisol. So too much cortisol can produce some of the hallmark signs of Cushing syndrome, which would be a fatty hump between your shoulders, a rounded face, and pink or purple stretch marks on your skin. Cushing syndrome can also result in high blood pressure, bone loss, and on occasion diabetes. Treatment for Cushing syndrome can return your body's cortisol production to normal and noticeably improve your symptoms. The earlier treatment begins, the better your chances for recovery. Common Cushing syndrome symptoms include weight gain, particularly around your midsection, fatigue, muscle weakness, rounding of the face, facial blushing, fatty pad or hump between your shoulders, and pink or purple stretch marks, and thin and fragile skin that bruises easily, and slow healing of cuts and insect bites, depression, anxiety and irritability, loss of emotional control, thicker or more visible body and facial hair, acne, irregular or absent menstrual periods, and decreased libido, erectile dysfunction in males, new or worsening high blood pressure, and glucose intolerance that may lead to diabetes, bone loss leading to fractures, and headache. So, your endocrine system consists of glands that produce hormones, which regulate processes throughout your body. These glands include the adrenal glands, pituitary glands, and thyroid gland. The parathyroid glands, pancreas, ovaries, and testicles. So your adrenal glands produce a number of hormones, including cortisol. Cortisol plays a variety of roles in the body. For example, cortisol helps regulate your blood pressure and keeps your cardiovascular system functioning normally. It also helps your body respond to stress and regulates the way you convert proteins, carbohydrates, and fats in your diet into usable energy. However, when the level of cortisol is too high in the body, you may develop Cushing syndrome. So next is, how do you treat Cushing syndrome? Treatments for Cushing's syndrome are designed to lower the high level of cortisol in your body. And treatment options include reducing corticosteroid use. If the cause of Cushing syndrome is long-term use of corticosteroid medications, your doctor may be able to keep your Cushing signs and symptoms under control by reducing the dosage of the drug over a period of time, while still adequately managing your asthma, arthritis, or other condition. Next treatment is surgery. If the cause of Cushing syndrome is a tumour, your doctor may recommend complete surgical removal. The pituitary tumours are typically removed by a neurosurgeon who may perform the procedure through your nose. If a tumour is present in the adrenal glands, lung or pancreas, the surgeon can remove it through a standard operation, or in some cases by using minimally invasive surgical techniques with smaller incisions. Another treatment is radiation therapy. If the surgeon can't totally remove the tumour, they will usually prescribe radiation therapy to be used in conjunction with the operation. Additionally, radiation may be used for people who aren't suitable candidates for surgery. Next will be medications. In some situations, when surgery and radiation don't produce a normalization of cortisol production, your doctor may advise drug therapy. Medications to control excessive production of cortisol include ketoconazole and methylprednisolone. If none of these treatment options is effective, your doctor may recommend surgical removal of your adrenal glands, bilateral adrenalectomy. And left untreated, Cushing syndrome can lead to death. However, most often treatments improve signs and symptoms and normalise cortisol levels. So finally, how do you live with a diagnosis of Cushing syndrome? People living with Cushing syndrome often have to cope with many physical and emotional issues caused by their condition. Even after successful treatment, the effects of Cushing syndrome can linger for a while. Fortunately, there are things you can do that can and make living with Cushing syndrome a little easier. So move forward with treatment recommended by your doctor. Once the cause of your Cushing syndrome is found, your doctor will recommend an appropriate treatment. Follow through with the treatment chosen by your doctor, and seeing your doctor regularly to make sure treatment is working are the most important ways to control or get control over Cushing syndrome. Learn all you can about Cushing syndrome by finding out as much as you can about Cushing syndrome. You will be well-informed patient who can partner with your doctor to help get control over your Cushing syndrome. Finally, before I finish, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you in managing Cushing syndrome more effectively. To start with, we have numerous products to get you up and running and started on an exercise program, such as exercise balls, floor mats, weights, and various other necessary equipment required, again, to get you started on a program tailored for you. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30 minutes clinic with us, and we help you increase your understanding of your illness. During a telehealth clinic together, we create a cohesive management plan which enables you to take a more active role in managing Cushing syndrome with confidence. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.